Diabetes mellitus is a group of metabolic disorders characterized by high blood glucose levels due to defects in insulin secretion, insulin action, or both. It is a significant global health concern, and early detection and diagnosis are critical to managing the disease and preventing complications. There are several tests used to diagnose diabetes and assess blood glucose control. Types of diabetes mellitus. Before diving into the diagnostic details, it's important to understand the different types of diabetes. Type 1 diabetes, an autoimmune condition where the body's immune system attacks insulin-producing beta cells in the pancreas. It is typically diagnosed during childhood or adolescence, but can occur at any age. Insulin therapy is required for survival. Type 2 diabetes, a metabolic disorder where the body becomes resistant to insulin, or the pancreas doesn't produce enough insulin. It is commonly diagnosed in adults and is often linked to lifestyle factors, obesity, and family history. Gestational diabetes, a form of diabetes that develops during pregnancy. It increases the risk of developing type 2 diabetes later in life. Maturity onset diabetes of the young, MODY, a rare form of diabetes that is usually inherited and typically diagnosed in adolescence or young adulthood. It is due to a mutation in one of several genes involved in insulin production. Other types of diabetes includes conditions caused by genetic defects in insulin secretion, pancreatic diseases, endocrinopathies, or drug-induced diabetes, e.g. corticosteroids. Diagnostic tests for diabetes mellitus. There are several tests to diagnose diabetes mellitus and assess glucose regulation. These tests are used both to diagnose and monitor the condition. 1. Fasting plasma glucose, FPG test. Procedure. The patient must fast for at least 8 hours before the test. No food or caloric beverages during this period. Blood is drawn in a clinical setting to measure the glucose level in the plasma. Normal range, less than 100 milligrams per dl, 5.6 millimoles per liter. Prediabetes, impaired fasting glucose, 100 to 125 mg/dl, 5.6 to 6.9 millimoles per liter. This is an indicator of a higher than normal risk for developing diabetes. Diabetes diagnosis, greater than or equal to 126 milligrams per dl, 7.0 millimoles per liter, on 2 separate occasions to confirm the diagnosis. A single high fasting blood glucose level may be suggestive of diabetes, but needs to be confirmed by retesting on another day. Interpretation. Fasting plasma glucose is a widely used test due to its simplicity and reliability. It helps assess how the body handles glucose after a period of fasting and reflects the liver's glucose output. 2. Oral glucose tolerance test, OGTT. Procedure. Like the FPG test, the patient must fast for 8 hours before the test. A baseline blood sample is drawn to measure fasting blood glucose. The patient then consumes a glucose solution containing 75 grams of glucose. Blood samples are drawn at 1 hour and 2 hours after drinking the glucose solution. Patients should be advised to consume a varied diet with at least 150 grams of carbohydrate prior to testing, as fasting and carbohydrate restriction can falsely increase plasma glucose level. Normal range, less than 140 milligrams per dl, 7.8 millimoles per liter, at 2 hours after glucose ingestion. Prediabetes, impaired glucose tolerance, 140 to 199 mg/dl, 7.8 to 11.0 millimoles per liter, at 2 hours. Diabetes diagnosis, greater than or equal to 200 milligrams per dl, 11.1 millimoles per liter, at 2 hours after glucose ingestion. Interpretation. The OGTT is a more comprehensive test that evaluates how well the body processes glucose over time. It is useful for diagnosing gestational diabetes, impaired glucose tolerance, and in situations where the FPG test might yield ambiguous results. It is sensitive to glucose regulation abnormalities that may not be detected with FPG alone. 3. Hemoglobin A1c, HbA1c test. Procedure. A blood sample is drawn, and the test can be performed at any time of the day, without the need for fasting. HbA1c reflects the average blood glucose level over the past 2 to 3 months, because glucose molecules bind to hemoglobin, the protein in red blood cells, and the amount of this bound glucose correlates with blood sugar levels over time. Normal range, less than 5.7%. This indicates normal blood glucose control. Prediabetes, impaired glucose regulation, 5.7% to 6.4%. Individuals in this range are at higher risk of developing diabetes, also known as prediabetes. Diabetes diagnosis, greater than or equal to 6.5%. This percentage reflects consistently elevated blood glucose levels over the past few months and is indicative of poor long-term glucose control. Interpretation: the HbA1c test is convenient because it does not require fasting and provides a long-term view of glucose levels. However, it may not be suitable for all individuals, such as those with certain blood disorders, e.g., hemoglobinopathies, anemia, that can skew results. Additionally, it is not used for diagnosing gestational diabetes. 4. Random plasma glucose test. Procedure: a blood sample is taken at any time of day, regardless of the last meal. This test measures the level of glucose in the blood at a single point in time. Normal range: there is no definitive normal range because this test is often conducted randomly. However, normal blood glucose levels are typically less than 140 milligrams per dl after meals. Diabetes diagnosis: a random blood glucose level of greater than or equal to 200 milligrams per dl, 11.1 millimoles per liter, is indicative of diabetes, especially if accompanied by symptoms of hyperglycemia, such as increased thirst, frequent urination, fatigue, and unexplained weight loss. Interpretation: the random plasma glucose test is useful when symptoms of diabetes are present. If a person has a glucose level of greater than or equal to 200 milligrams per dl and shows symptoms, the diagnosis of diabetes is likely, but the diagnosis is usually confirmed with a follow-up test, e.g., FPG or HbA1c. Gestational diabetes diagnosis. Gestational diabetes, GD, occurs during pregnancy and is diagnosed through an oral glucose tolerance test, OGTT. The test is typically done between 24 to 28 weeks of pregnancy. Diagnosis of gestational diabetes. Fasting plasma glucose, FPG, greater than or equal to 92 milligrams per dl, 5.1 millimoles per liter. 1 hour plasma glucose greater than or equal to 180 milligrams per dl, 10.0 millimoles per liter. 2 hour plasma glucose greater than or equal to 153 milligrams per dl, 8.5 millimoles per liter. If one or more of these values meet the thresholds, the diagnosis of gestational diabetes is made. If left untreated, gestational diabetes increases the risk of preterm birth, preeclampsia, and larger babies, as well as a higher risk of developing type 2 diabetes later in life. Other diagnostic tests for diabetes management. 1. Continuous glucose monitoring, CGM. Procedure: a small sensor is inserted under the skin to measure glucose levels throughout the day and night, providing real-time data on glucose fluctuations. Use: while not used to diagnose diabetes, CGM is a valuable tool for managing type 1 and type 2 diabetes, especially in insulin-dependent patients. 2. Urine glucose test. Procedure: urine is tested for the presence of glucose. Use: while historically used for diagnosis, urine glucose tests are no longer reliable because glucose is only present in urine when blood glucose exceeds 180 milligrams per dl, the renal threshold, and not all individuals with diabetes reach this level. Therefore, urine tests are no longer routinely used to diagnose diabetes. 3. Fructosamine test. Procedure: measures fructosamine, a compound that forms when glucose attaches to proteins in the blood. Use: the fructosamine test is used to assess glucose control over the past 2 to 3 weeks and is sometimes used when HbA1c is unreliable, e.g., during pregnancy. Diagnostic criteria for diabetes. Fasting plasma glucose. Normal range less than 100 milligrams per dl, 5.6 millimoles per liter. Prediabetes 100 to 125 mg/dl, 5.6 to 6.9 millimoles per liter. Diabetes diagnosis greater than or equal to 126 milligrams per dl, 7.0 millimoles per liter. Oral glucose tolerance test. Normal range less than 140 milligrams per dl, 7.8 millimoles per liter. Prediabetes 140 to 199 mg/dl, 7.8 to 11.0 millimoles per liter. Diabetes diagnosis greater than or equal to 200 milligrams per dl, 11.1 millimoles per liter. Hemoglobin A1c. Normal range less than 5.7%. Prediabetes 5.7% to 6.4%. Diabetes diagnosis greater than or equal to 6.5%. Random plasma glucose. Normal range less than 140 mg per dl, 7.8 millimoles per liter. Prediabetes not applicable. Diabetes diagnosis greater than or equal to 200 mg per dl, 11.1 millimoles per liter, with symptoms. Criteria for diagnosis of diabetes. 1. Sign and symptoms of diabetes/hyperglycemia plus fasting blood sugar level greater than or equal to 126 mg per dl, 7.0 millimoles per liter. 2. Sign and symptoms of diabetes/hyperglycemia plus random plasma glucose greater than or equal to 200 mg per dl, 11.1 millimoles per liter. 3. Fasting blood sugar level greater than or equal to 126 mg per dl, 7.0 millimoles per liter, on 2 separate occasions. 4. Fasting blood sugar level greater than or equal to 126 mg per dl, 7.0 millimoles per liter, plus oral glucose tolerance test greater than or equal to 200 mg per dl, 11.1 millimoles per liter. 5. Hemoglobin A1C greater than or equal to 6.5% on 2 separate occasions, or single hemoglobin A1C greater than or equal to 6.5% in combination with fasting blood sugar level greater than or equal to 126 mg per dl, 7.0 millimoles per liter, or random plasma glucose greater than or equal to 200 mg per dl, 11.1 millimoles per liter. Conclusion. Diagnosing diabetes requires a combination of clinical judgment and diagnostic testing. The fasting plasma glucose, FPG, oral glucose tolerance test, OGTT, and hemoglobin A1C, HbA1c, are the main diagnostic tools. Regular screening is essential for detecting prediabetes and preventing the progression to type 2 diabetes. Early diagnosis and proper management are key to reducing the risk of complications such as cardiovascular disease, kidney damage, and nerve damage.